Metrocare will be the prominent provider of treatment for mental illness and disabilities in this part of the world for the foreseeable future. This part of the world is growing, so we need to be ready to grow with the population as it builds here. In addition to that, we've done a great job, I think, as a society of reducing stigma and trying to help people see the need for this kind of care. So that brings in itself a need for greater capacity, greater access, more effective treatments. Those are the things we're going to be doing over time. Metrocare is one of the largest providers of mental health and intellectual disability services in the country, and certainly the largest in North Texas. We have programs for birth to death, so we help people who are born with disabilities and need that extra bit of treatment and help to get to school age and be ready with their peers. We help people in their teens and 20s who've encountered mental health and intellectual disability issues, and we take that all the way through the end of life, where we work with people right up to the time that they leave us.
The Early Childhood Intervention Program at Metrocare, ECI, is a program that works with babies from the time they're born until their third birthday by providing an array of services. We provide therapy services to babies with developmental disabilities. I believe the ECI program at Metrocare has made ripples in our community through little celebrations, little successes. And I like saying little because we're working with little ones. When our babies say their first words, mama or dada, or take their first steps, I believe that carries over into the future of those little ones' lives, and they go into our community and they contribute to our community here in Dallas. We believe at ECI that our little ones, once we're able to support them with meeting their developmental milestones, they are then able to take that and participate in our community. They're able to go to school and be in a normal classroom. Then when they're adults, they're able to work in our workforce and be members of our society. And perhaps if they didn't have that opportunity when they were little and they were struggling with meeting their developmental milestones, they wouldn't have been able to participate in a meaningful way and a satisfying way for them.
So Metrocare's housing program is a permanent supportive housing program. So our goal is to transition individuals who are experiencing homelessness into our housing program so they'd be positioned in an apartment complex, in their own unit, or sometimes in a shared setting. Once an individual is positioned in their housing, the clinical case manager is going to be working with them on an ongoing basis to do home visits with them, to help develop a recovery plan collaboratively with that individual so that we can help them meet their goals. The impact that this program provides is it's a safety net for individuals who really don't have many other opportunities to break that cycle of homelessness. And so our program affords them the ability to rebuild, have a safe place where they're not on a clock, where they have to leave soon or find something else soon. They're in a permanent supportive housing spot. I always tell the people that I work with that they have the gift of time in our program because they can take a breath and take time to recover.
The homeless program at Metrocare is here to serve the homeless that are in the streets and in the shelters for their mental health needs. We are able to deliver services at several locations, including the Bridge, the Stew Pod, Austin Street Shelter, Dallas Life, and Turtle Creek Manor. So I've been working on the streets for 8 years now and noticed that almost yearly there's an increase in the homeless population every year from people from all out of state, from everywhere around the country are coming here. So that helps aid in that increase. I've always loved helping people. That's always been something I've been doing all my life, and I've been doing it here for about 8 years now. And just the ability to just help somebody that's at their lowest point and just give them a little bit of hope, that's one of the main reasons I stay. Well, I hope the word of what we do spreads throughout the community so that new people are influenced by the people who have been here and done it before, that, hey, this does work and they can help you if you work with them.
The Texas Correctional Office on Offenders with Medical and Mental Impairment. It's a program that's designed to work with offenders who have medical conditions or mental health issues. and we provide intensive case management services to that population. Definitely, the program aids in recidivism, right? Keeping people out of the jails and out of prison. And one of the ways that we do that is we bring awareness to their mental health, and we give them the intensive services that they need, psychiatric services, medication clinic, linking them to community resources. And we found that if they are stable mentally, that does keep them out of jail. So one of the programs with our Tacoma program is the jail diversion program, and that program is so unique in that we work specifically with the presiding judges, the assistant district attorney, the public defender's office, probation. We meet as a staffing team, and we talk about the clients in the program and their progress and how they're doing. And if they're not doing well, we really sit down and focus on what can we do to get these clients back on track. So within the jail diversion program, we have 6 specialty court programs that we work directly with through the Dallas County courts. And the participation time in that program, our clients are in the program anywhere from 6 months to 18 months. And after the 18 months or after the 6 months, they successfully complete the program and their legal obligations have been resolved.
Veteran Services at Metrocare exists to provide quality mental health services and support to not only veterans but their family members as well. So we provide services at our Stephen A. Cohen Military Family Clinic for mental health. We also provide services for supportive services for veterans and family members, and our Military Veteran Peer Network is able to provide classroom settings throughout the Metroplex, as well as groups at different universities and centers alike. So during my time at Veteran Services at Metrocare, I've seen the need for veterans and their families to have a touch point in the community for services that were not only quality services, but where they understood the culture of a military community.
The Chemicaldependency Program assists individuals within the community that is struggling with alcohol or substance abuse. We have IOP, which is intensive outpatient. We have SOP, which is supportive outpatient, as well as aftercare, which is not mandatory but strongly suggested for ongoing recovery. Well, I believe that it's through the identification that we get our hope. And I myself is in recovery for the last 25 years, so I understand the process. I have a young lady who have had an open CPS case for almost 6 years, and the system really didn't think she was going to be able to reunite with her children. But as a direct result of her coming to IOP and completing SOP program and currently in the 12-step program, she has successfully regained custody of her children, and she has over 2 years of complete abstinence from all mind, mood altering chemicals. And she's just an example and a hope for many other women that if she did it, they could do it too. I would like to be in the unemployment line so that I could see that the program is actually making a large impact in the community at whole, so that all the individuals could actually find a new way to live.
We were named in honor of Dr. Kenneth Altschuler, who's with UT Southwestern. We kind of follow in his mainstream of providing public mental health services for the community, and that's what we do here as far as with education and research. I think that the impact is, first of all, Metrocare Services has a great impact on the community. And I think by having ACER services available or ACER education available is because we can offer the extra stuff that Metrocare has. All of the doctors that we have, the people that come for services. And so by us being able to provide and show what we can train people to do future training or future work in public mental health, we have that capability. We are in terrible need of more public mental health. Metrocare has been one of the only agencies around that have been able to provide services for the public mental health. So there is a dire need to have people working in that field, not only in Dallas, but in the state of Texas and in the country. And that's what we're here for, is to provide that training, that research, and that knowledge, and speaking out about the need of having public mental health services available.
Lettis stands for Local Intellectual Developmental Disability Authority, and we are the point of entry for individuals and families that reside within Dallas County. Some of the services include service coordination, behavior support, day hab, respite, crisis intervention, and vocational training. We also oversee the enrollment process into the Medicaid waiver programs, such as Home and Community-Based Services, also known as HCS, Texas Home Living, State-Supported Living Centers, and the Intermediate Care Facilities, also known as ICFs.
The Center for Children with Autism at Metrocare is a center-based program that provides applied behavioral analysis-based services to individuals who have a diagnosis on the autism spectrum or other developmental disability. What makes CAM unique? It is different than most of your traditional ABA programs that you're going to find here in the Dallas area. We provide services to those kids who wouldn't traditionally be able to afford it. A lot of our children have Medicaid funding, and in the state of Texas, Medicaid doesn't pay for ABA services. So we're unique in that we find a way to provide those services to those kids and get them the therapy that they need. Our vision for the program is just to continue to provide those services for the individuals who wouldn't typically be able to get them from a traditional ABA program. Some of the coolest things that I've seen with these kids is a child that comes into the center and has no language whatsoever, and then working with us and working with the parents to provide that treatment, they say mom for the first time. We had this kid that on his mom's birthday, he said mom for the first time, and his mom was in tears, and we were all in tears, and it was just amazing what an impact you can make on a kid's life, that someday they will be able to grow up and make an impact on society.